Okay, so welcome to this 60-minute webinar, which will introduce you to the basic searching concepts on CINAHL on the EBSCO interface. So CINAHL being the definitive resource for nursing and allied health research. In this session, we'll look at keyword or free text searching, refining search results, viewing, printing, and emailing results. So that's what you're expecting. So just to formally introduce myself, I'm Richard Crooks. I work for the EBSCO Customer Training Services team and currently manage a team of trainers based in the UK and also who support the Nordics and Africa. So by all means, feel free to contact me if you need to at some point post-session. But thanks for joining today's session. So please use the Teams chat for any comments or questions that you may have. Okay, in terms of the actual webinar, I hope that by the end of this particular session, you'll be able to perform a basic search on CINAHL to find articles of interest. You'll also be able to refine search results using available limiters and also be able to view, say, print and email articles from this interface, EBSCOhost. You'll also be able to use the personal EBSCO folder account to save articles beyond the session. And also you'll be able to find further help and support information on CINAHL databases. So again, I hope that's what you're expecting from this webinar this morning. So trying to clarify this because obviously, depending on where you're based, and this session was originally intended for those who are based or work within the NHS in England, so library staff primarily, but also end users. So what I want to mention here is that in terms of the demonstration, we will be looking at the basic CINAHL database, which is the abstract and index only database. There's a quantity of full text journals. But as you see, there are different versions of CINAHL. So you have CINAHL with full text, CINAHL plus a full text, which is used in NHS Wales. You have CINAHL Complete, which is also available for the HSE in Ireland. And you have CINAHL Ultimate, which has been adopted by some NHS organisations, other institutions as well, so universities, colleges, etc. So you've got multiple versions of CINAHL. However, although I'm focusing on the CINAHL, the initial database there, the principles for searching will be the same across the board. The big difference, of course, will be the availability of active or ongoing full text content and also content that's not embargoed, okay, which specifically I'm referring to CINAHL Ultimate there. So again, whichever version you're using, the principles that we look at will be applicable. One other thing to mention here also is that because this session was originally intended for NHS librarians, library staff in England, the access points may differ where you are as well. So for those who work in the NHS in England, you can go through the NICE website, so nice.org.uk. And on this page, you can scroll down and you can access the Find Journals and Databases link. That in turn will take you to the following page, the Knowledge Resources page for NICE, and there you can log in to Open Athens, etc. Okay, so if you work in the NHS in Scotland, you may be going through the Knowledge Network portal. If you work for the NHS in Wales, you may be going through the eLibrary for Health. If you're in Ireland working for the HSE, then you'll go through the eHealth Library Ireland site as well. So, and of course, if you work for the university sector, you may have a dedicated link within your library website to get to CINAHL or an AZ listing of databases. So it will differ between institutions, between sectors as well. This is specific for the NHS in England. Now, once you log in, it will take you to this page. This is where you enter your Open Athens credentials. So Open Athens is the primary means of authentication within NHS in England, and that will then allow you to navigate to the My Resources portal for Open Athens. So if you do use or have access through Open Athens, this may look familiar. That will then take you to the EBSCOhost databases link, and from there you will link through to the following page, which is our Choose Databases page. So basically, it allows you to select the preferred database on the EBSCOhost interface or platform that you'll be using. Now, since this is the NHS England site, as it were, as part of the National Core Content Deal across England, you've got access to CINAHL, Medline, Psychology Behavioral Science Collection, and others as well. But we are going to focus on CINAHL specifically. And on this page, you'll see a brief description of the database with a title list, which you can browse to see what publications are indexed. And also there's more information specifically on CINAHL, on that database. So again, your access may be different depending on where you are. You can also go through the Open Athens website, openathens.net, and choose the appropriate links there, and that'll take you to the newer, this new page, as it were, and then that in turn will take you through authentication to the My Resources portal once more, And again, follow the link to EBSCO's databases, and then you'll come to the list of databases. So that's just a review for those who work in the NHS in England in terms of access. Obviously, for those who are other sectors or institutions, you will need to consult your local library service if you yourself are not working for the library service. Now, in terms of actual searching, just to clarify in terms of background, as this is a basic level webinar, in terms of the free text or keyword searching, when you search CINAHL, you are automatically searching the following fields. So you're searching directly for the keywords if they appear in the abstract, title, abstract, the subject headings, and the CINAHL subject headings, that's word indexed. So it's not the specific subject headings, which is used by indexers to identify content. It's simply looking at a keyword search of those index terms. PubMed ID if appropriate, digital object identifier if appropriate, and also author field. So automatically, when you enter a term or terms, it's going to see if any of those terms appear in any of those fields. If they do, in at least one occurrence, it will bring back results in the result list. If you contrast that with Medline, the biomedical database, you can see additional default fields there, including the author affiliation there, keyword owner, and so on. So we do have more information about the unqualified searching. So this is basically a general keyword search that we're going to be looking at today. The next thing I want to cover is the actual search modes and expanders. So search mode basically determines how CINAHL is searching when you enter your search terms. So by default, for those who work in the NHS in England, the Boolean phrase search mode is on. So essentially, behind the scenes, this is configured to search for words as they appear next to each other in the order that they are entered. Okay, so there's some customization options that you can perform to change the configuration of the search experience. Again, I won't get into details about that. That's something that the library services take responsibility for. And of course, some of this is national. So again, we are looking at a nationally available database CINAHL, so there is a central administration of this search experience. So again, you may not have that much control over how that's configured. It would have been agreed at a national level. Of course, if you are an individual organization, then your library service or yourselves would have configured it as appropriate for your users. So Boolean phrase searching is on by default. We'll see that live in a moment. We have also additional options to expand your search results. So apart from searching for your keyword search terms within the fields I mentioned in the previous slide, you can also apply these expanders. So we have apply related words. So what does that do? What it does essentially take your search term. So for example, if you put in child, it would look for synonyms, for example, pediatrics, children, and plurals from the thesaurus. Okay, you can also think of alcohol, it will look for alcoholic, alcoholism, but only if those terms are part of the CINAHL subject index. So that's what I mean by thesaurus. So specifically, it will go to the CINAHL index terms and identify any synonyms or plurals that relate to your keyword search terms. So it's basically expanding to include content which has been indexed by various subject headings. The second one there also relates to keyword searching, but within the full text document itself. So as you can appreciate, we have a quantity of full text journals, 70 or so available within CINAHL. If you have CINAHL Ultimate, then you're looking at a 4-figure number of active full text journals, or book chapters, or etc., or reports. So basically, they expand your search beyond the default unqualified search to search within the actual body of a document, be it book chapter, journal article, report, etc. Then apply current subjects, which is defaulted to on in the NHS setup. That will take your keyword search and map it directly to subject headings to retrieved index records. So just to clarify that a bit further, if you consider the term or workplace injury as a search, okay, so the search term workplace injury maps to the concept of work-related injuries. So with that concept in mind, we have a team at EBSCO who've identified subject headings from the CINAHL database which would relate to the concept of work-related injuries. So instead of just bringing back results based on workplace injury, you are also going to retrieve results that have been indexed with occupational injuries, occupational-related injuries, and work-related injuries. So it's expanding to bring back results based on the indexing content, but that relates to a concept which in turn has been mapped from your original search. Okay, so again, these are all seeking to expand your search results. They have also various uses, particularly if you have problems finding particular references. Maybe the topic is pretty new. If you think of COVID 3 years ago, then that was a very new topic. And so the literature on COVID-19 was very sparse indeed. But again, these expand your results to include essentially index content in this particular aspect, okay, of apply-frequent subjects. Now, for those who are based in England, then you have EBSCO single sign-on available. So what that means is essentially when you authenticate into CINAHL with Open Athens, then once you click the sign-in option within the folder menu, then your folder will be created automatically. So essentially, we have these personal folders that can be created, that can be set up so that you can store items beyond the session. With the NHS in England, with single sign-on, that will be done automatically. You'll be signed into a folder, so when you save content, it will be saved beyond the session. If you're outside of England or other institutions that do not have single sign-on, then it means you have to sign up for a folder account, create it, and then you can use it thereafter. So I'll take you through to that process shortly as we go through the demonstration. Now, for those of you who've used, who've created folders in the past, who are new to this, you may need to merge the previously created folder with the newer one. There are steps to do that, and there's instructions on this slide here with that link, how to merge personal user accounts. So it's possible to merge them if you need to, okay? So again, that's something we can follow offline if we need to, but this has been around now for a couple of years, so probably most of you are aware of this functionality, particularly those who work in the NHS in England. Okay, so that's enough of the background for now, and I will now focus a bit more on the live demonstration. So let me just move on to my desktop. So I'm going to share that now. So you should see the NICE website, nice.org.uk, which is quite often the entry point for NHS library staff, users to get to CINAHL and related databases. So if we scroll down here, you'll see there's a reference here, there's a box here to explore NICE, and then the reference to find journals and databases, which you saw in the slide deck. So if I click this link here, it takes us to this page. Again, if you work in other sectors of the NHS in other parts of the UK, or if you work for the NHS in Ireland or in the university sector, you may have different access points, AZ links, etc. to the database. So we'll scroll down here, go to log into Open Athens, and what you'll see here, I'm already signed in. So typically, I've signed in already, but you would have the sign-in page, enter your Open Athens username and password, and it will take you to this page. So from here, you can go to the EBSCO databases. That will take you to this page, and then we'll go to EBSCO's research databases, and that in turn takes you to this page. So a few clicks. So we are going to focus on CINAHL. As you see here, we've got CINAHL indicated. We've got the title list here. So if you want to browse the list of available publications, index with CINAHL, you can check this list. You can also go to the alpha menu as well to explore by letter as well, and you can also do keyword searching to find particular titles here as well. You can also access the same list from the publications link in the toolbar, which you'll see on the interface as we begin searching. We've also got more information. This will give you literally more information on CINAHL. So if you open this up, it takes you to this menu, and if we go to searchable fields, you'll see here we have the default fields for unqualified searches. So I mentioned this in the slide deck in the PowerPoint. So again, this is just to verify that information. Okay, so there's more information on this page for CINAHL, and to the left of this menu, you also see other links to other elements of searching as well, okay, within the EBSCOhost interface. So EBSCOhost is simply the platform or interface that we're using to access CINAHL. So if we go into CINAHL, just click through here, you'll see this takes us to this page. This is the advanced search page. However, we are going to be running a basic search on this page. Okay, there is a basic search screen. Some of you may have access to this. I'll click on that link now. This gives you a very Google-like appearance with a single search box, and there are search options below, which I'll talk about in a moment. But for those who work in the NHS, you'll be accustomed to coming to the new search screen like this, or if you're in the HSC in Ireland, and run searches in this way. So you can see already we've got the search boxes there. We've got the search options below, which I mentioned in the slide deck. Boolean phrase, again, this is the default search for those who work in England in the NHS. So that's searching for words as they appear near each other in the order they're entered. We have the expanders there, which I referred to, the apply rated words, also search within full text, and apply current subjects. Now, there are other limiters here. We won't go into those today. We may cover those in the future, but there are other limiters that you can also apply to your search as well. So we'll begin with a search here on influenza vaccine, which I think is quite topical at this time. So what I'll do, I'll just enter my keyword search terms as so. And okay, so I'm going to do that now. Okay. So we've got the terms influenza vaccine, and what I'm also do is apply this one, also search within the full text. I've got apply current subjects on as well, so that would retrieve similar records based on the concept of flu vaccine or influenza vaccine from the index terms. So the index terms for CINAHL are listed under CINAHL subheadings. So you can browse the thesaurus here, keyword search, etc. So we're going to run this search now as is. So click search here. And what it will do now is bring back the results with our search history displayed above. So search history just displays how we're searching. So we have our search terms, we have the expanders that have been applied, and we have the search mode confirmed Boolean phrase and the results there. On the left-hand column, we also have what we call the breadbox, which keeps a track of how we're searching. And in a moment, you'll see how to refine as well. So it tells us we're searching for influenza vaccine using the Boolean phrase search mode, and we've applied these two expanders. You can remove them by clicking the cross next to each one and just revert back to the standard search if you prefer. Now on the left-hand column, we also have additional limiters. You'll see here linked full text. So while some may say full text or full text online, linked full text here implies that we have other publications that are available through other providers, publishers, where the full text is available. So we're not only going to bring back results that are available full text within this database, but also go externally to retrieve other online items that library services have access to through various subscriptions. So if I select link full text here, we're going to narrow our results quite considerably here because we're now down to 4,000, a third now of what we had before, roughly a third. And we will also apply other options as well. Now you'll see with item 2, this has cited references. There are 4 of them. So if you chose references available, you would end up with all results that have cited references indicated. So if you want to explore those, you could. As you see, a number of these don't have cited references. Abstract available, so that could be an alternative to limit it by full text. You'll see for these records here, this one does not have an abstract. This one has the first line of the abstract. And if you want to view the entire abstract, just click or hover over the magnifying glass there, and it gives you the abstract available there. If they do not have the abstract, then obviously they won't show in the associated option here, as you see. So not everything is abstracted, not everything has a summary. So you can focus on those that do if you wish. On the left-hand column, we also have the publication date slider, as we call it. Basically, you can limit your results to a date range. So we have 1979 to the present. Obviously, we're going back well over 40 years there, so it's probably too far back to check out results on influenza vaccine. So what we might do here is just grab this left-hand box there and scroll, and then we'll go to the last 10 years. So 2013, in which case will be from January 2013 to the present. So we're limited now for results published since 2013, so the last 10 years. You can also, by the way, enter the year in the box provided if you do not like to use the date slider itself. Now, source types indicates the kind of media content that we have within CINAHL. So you can see we've got academic journals primarily. We have magazines as well. So these could be like news type magazines, CEUs, continuing education units. These are basically articles, items which have some form of nursing assessment. And we have the occasional book as well. Also, dissertations are also included here as well. So we're going to go for academic journals specifically here. So look at more authoritative literature, as it were. We'll then scroll down. We won't use the subject major heading. We'll cover that in the advanced session. But we've got publication here. So if you are looking for a particular article about influenza vaccine, maybe you saw something in epidemiology and infection, you could choose that option. Or the Lancet Infectious Diseases Journal, you could choose any one of these. You've got publisher here. This may be particularly relevant to library staff. So if you're looking at Sage publications, there are 96 Sage publications from this result list that refer to influenza vaccine. We have language. So depending on your language skills, you may be multilingual. English may not be your first language. You can choose the other languages. If you have HTML full text available, so you'll see someone says get PDF, there are other links here, which I'll say more about in a moment, then it's possible to translate that article as well. So you can translate it from English to another language or another language back to English if you need to. But we'll focus on English here in this instance. And then you've got, see here, age and gender. So age and gender relate to the indexing of content within CINAHL. We'll look more of that in the second session, the advanced session, which you may want to sign up for. But if you look at item 7 here, improving pediatric influenza vaccination rates, you'll see child 6 to 12 years is mentioned here. If we scroll down, you may see some others here. So for example, this one on 9, this relates to a prevalence survey in southern Italy. You'll see adults 19 to 44. So age group relates to the indexing of content. In other words, indexers have reviewed the article and they've assigned that age group as a subject heading to that article to confirm that it features that age group, that population group. Likewise with gender as well. Okay. Now, geography, just to mention this as well, you have geography here. You see you've got Europe, you've got UK and Ireland, USA, continental Europe, etc. Now, this relates to country publication. So while we can go for UK and Ireland here, and then with 600 journals, in a moment, you'll see if we scroll down, you may find that some of these articles are not referring to the UK and Ireland. So for example, this one, item 4, relates to influenza vaccines in Kenya. But it's published in the BMC Medicine, the UK journal. Let's see some more here. Let's go to, again, that's repeated there, I think, that one. China as well, there. Korea, Kenya, well, that one's, for some reason, that's been, yeah, interestingly enough, it's been showing up 3 times here. I'm not sure what that is. But Mexico, this one's in Mexico as well. So again, UK and Ireland, is only really useful if you're looking for a particularly locally available journal publication. It doesn't guarantee that the research relates to a UK or Irish population or to any of those countries. Okay, so what I might do here is remove it from the list of results. So where you see the current search, the various options we've applied, including the filters or the limiters, we can remove this one. So if I click the cross here and go back to the original set of results. Okay. So I think we'll stick with these for now. And what I'll do, I'll also hide the search history. So you can see the search history is recorded here. But if I click search history below the search box, we can remove it and hide that. So focus on our search results. Now, by default, in most cases, you can verify this based on where you are. The default search results are displayed with the most recent first, date newest. So this is kind of in keeping with healthcare research. You want to see the latest research, etc., on a given topic, condition, disease, or so on. But in this case, I'm going to focus on the relevancy. So if I click the link here, or this button, and go to relevance, we've now got this one here. Okay, so this relates to the surveillance of vaccination coverage of inactivated influenza vaccines, etc. Okay, and this is from the, let's see, interesting, it's not really clear which journal this is from. Maybe I'm missing something here. On Lynn Inquiry, so I've not heard of that one before, it's a new one to me. So there are these references here, and if we just take this one, Journal of Behavioral Medicine, you can see this one here. This relates to college students, influenza vaccine hesitation, quantitative data. Okay, now you can see here, if we look at some of these, there are different links here. So for example, these initial 2 have get PDF, view complete issue. Get PDF is simply a link resolver called libkey provided by libkey nomad provided by Third Iron. So they are the company that provide the article. Okay, so this is a Sage article that they have access to, that they provide access through that link resolver, as it's called. Okay, so you get the PDF there. You can go and view the complete issue. This is using their browsing service from Third Iron, with which libkey relates to. So again, you can see the article here within the context of this particular journal issue. Now, so get PDF, view complete issue are coming from an external provider, Third Iron. Get PDF is the libkey nomad link resolver, and you can see that when you hover over the button there. And then this view complete issue relates to the browsing, which is the AZ list of journals provided by Third Iron. If you scroll down, you would have noticed this one, item 3, which I just referred to. This has links from within EBSCOhost. So you have the HTML full text here. So if I click on that link there, then this will give you the online article that's available full text. You'll see on the left-hand column, PDF is also available here. But just to focus on this one, you'll see the translation option is available. So for example, If you wanted to translate this from English to Welsh or Danish, you could do so, or Spanish, etc. So if I click on Spanish, for example, Español, then you'll see as I translate this, the article will be literally translated into that particular language. Okay, so it does reverse as well. So if you come across an article that's in Spanish, you can translate to English. Now, if you're a native Spanish speaker, I don't know if we have any right now, you'll know how accurate or how effective that is. It is provided by Microsoft, as you can see. So it's a Microsoft translation, okay, of this article. So again, it's going to translate straight into Spanish there. You can, of course, go back to the original language, which I'll do so, as I don't speak Spanish. And, so you can choose any of those languages to translate as needed. Also, one of the key things of HTML, it's easy to navigate. You can jump down, check references, etc., go back up, and so on. There's also additional functionality here, and that is the use of text-to-speech software. So you can see listen here. So this is a new feature, actually. This basically is giving us an option to download. Also, you can download the MP3 here as well. So go down to your downloads folder. So that it does vary. We are in kind of a transitional time at EBSCO because we have a new interface. For this interface is changing. So by next year, next summer, this will look quite different. We will be running training on that. But this is what we call the EBSCO's classic interface. So this is gradually being superseded by the new interface, which has new software options. So while we can listen to, the article being read in a choice of English, Australian, English, or American accents, and you can download the MP3 here. With the new interface coming out next year, you'll be able to do the same for PDF full text as well. So at the moment, the text-to-speech software only works with HTML full text within this platform. It does work for PDF within the new interface, which is still undergoing development for those who work in the healthcare sector. Okay, there are other options here as well, as you have noted. So you've got the reading voice here, the choice of accents. They're all male apart from the English accent. So, you have Jack, the Australian there, Alice and Hugh are the English accents, and Mark and Paul, the US accents. You choose which one's appropriate there. You've also got this text mode as well. So you can read this in text mode if you prefer. And again, this functionality is largely to assist people with increased accessibility to content, especially if you have visual impairment, etc., and so on. So those are there, and you can zoom out, zoom in, etc. You can change the font size as well, as you see here, the colors as well. All those can be changed as appropriate. There's also the page mask, so it allows you to review content highlighted here with this bar across the page. Okay, and then you also have the option to download the MP3 through the ReadSpeaker web reader software. So again, you just agree and download the file for that. So that means you can listen to the audio of this article being read. So if you haven't got time to read it, you might be traveling, you can listen to it offline at some point. One thing to note also on this page is that you have additional options to process. So you have the tools on the right. We support the use of Google Drive here. So if you have access to Google Drive, I won't sign in now. You can save to Google Drive. You've got OneDrive also likewise. So you can sign into your Microsoft OneDrive account, save it accordingly. You can add to the folder. So this is the personal folder I referred to earlier. So that folder icon allows you to save to the folder, and you can access that article from the folder on the top right toolbar. Okay, and you can see that stored here for this duration of this session. There's the print option as well. So if you prefer to print a hard copy of this item, you can do so. Probably not so much HTML full text because it is intended for online access. But when it comes to the PDF, you may want to print it off. You've got the citation format. So to adhere to local guidelines, for example, NHS primarily uses Harvard, I believe, or a variation of that. So although it does give you the Harvard referencing format, we do advise that you consult your local library service, or if you're part of that library service, you would educate your users accordingly. There is a customized option as well. So again, you can choose various fields. So when you're printing, it would display with that field format. We have the email option too. So if you prefer not to print, but just want to email this article, then you can do so. Add your email address. You can use multiple addresses with a semicolon, and then you can choose the options to include the HTML full text. PDF as a separate attachment if preferred, if that's available. And again, you have the citation formats here. So again, any comments or questions on any of these features would be welcome. Okay, so those are there. You can also save as well. The save option there shown by the disks, which we no longer use, but you can save this again, choose the format, etc., or go for the standard field format and click save. Now this was typically useful for Internet Explorer, if you remember that still, where you'd save as a text file. But if you right click on this page and print, it will allow you to save this as a PDF, or you can simply send it to your printer, etc. Change the format as well. Okay, so it just opens up a menu to process further. And in addition, we have the cite tool here. Again, this relates to the citation format that you're using. So if you want some guidelines on how to cite this particular article in different formats, you'll see them alphabetically listed here. Chicago there, Harvard, Australian Harvard, MLA, Vancouver, and so on. So it gives you the exact match of this particular article we're viewing. But as you see, pay special attention to personal names, capitalization, and dates, and always consult your library sources for the exact formatting and punctuation guidelines, as we know there are variations of these as well. I won't cover export. We cover that in the other session. In the other session we run, we've got create a note here. So if you want to annotate a record, if as you're reading it something comes to mind, or you want to make a comment, then you can do so here. Whatever it might be, and you can save this to your folder as well. So you can save, sorry, I typed that in wrong there, but you can print the list or sign into store notes as well, by the way. The final thing I'll show as a tool is the permalink as well. So if you wanted to just send a link to this item, maybe you want to share it with one of your colleagues, etc., then click the permalink, and that will give you this option to copy this URL, and you can paste it into Teams, WhatsApp message, it could be your email, etc., to forward this link. Then whoever sees it would need to authenticate in the same fashion. So if you send it within your institution, they would use the same method of authentication to click through to this page. So this link would correspond with this HTML full text page here. Now, you'll see this PDF full text also available here. If we go back to the result list, and say, for example, you prefer to look at PDF, again, this is coming from within EBSCOhost, then you'd click that button there. It'll take you to the e-reader page, and you can view the electronic reproduction of the original article. So this is as it appears in print in the actual journal. Of course, you can expand that as well. You can download it from the toolbar within the e-reader window. You can print as needed as well from here, which means you can still say it's a PDF or just send it to your printer. And that's not currently listed for some reason. We have the tools again on the right, Google Drive, OneDrive again, you can set to OneDrive. You've got the print icon there on the tools. You've got the email option also to email this PDF, in which case you can again enter your email address or addresses, untick HTML full text if you want to just send the PDF, and choose citation format as appropriate, and then send. And you get confirmation on screen. The cite tool is also available again from within the PDF page, so you can consult that further. And also the export there. Permalink, again, this time the URL that is brought up here, and that's used in contrast to using the browser URL. The browser URL is only for the session. So do not use the browser URL in this context. Please use the permalink to, for linking directly to this PDF article. So if you want to print it, you don't want to email the full text article as an attached file, then you could just cut and paste this into email or any social media, as it were, and whoever picks it up would then, within the institution that is, so for example, Teams, WhatsApp, then they would then click through and authenticate to access this article. If you send this to another institution, maybe you have someone, a fellow student or colleague, and they do not have access to these databases, then they will not be able to get to that article in this way. They would still need to authenticate. But if they do not have access to this database, they will not be able to access this article. Also, on the left-hand column, you'll see you can explore other articles within the same journal, the Journal of Behavioral Medicine. So, for example, you can go to this one. Okay. You can also choose another issue. So click on that on the bottom left there. And if you go to 2023, you can go to the August issue, issue 4. Explore that further, etc. Okay. to go out to the result list. So that's the HTML PDF full text. Now, of course, you may just click through to the actual article itself, the detail record link here. This is the actual bibliographic record of this item. So you have links to the author, so you can link through to other authors to see other articles they've been responsible for. You can see the affiliation, where they're based, the link to the journal. You can link through to various subheadings here as well, which we'll say more about in the advanced session. So you have those items, and again, you have the same tools available. So if you wanted to send a link directly to this page, then you go to the permalink tool, and you would cut and paste this into the appropriate email, whatever it might be. Okay. Now, again, you see view complete issue here. So view complete issue is simply using third eyes browsing AZ journals to link you to the actual publication and where the article is available through that particular issue. So again, that's just another option there. Okay, so just moving on here. Now, obviously, you may be looking to select various articles from this list here. You may explore more full text, but you can actually obviously go through this listing. You can change the results format, by the way. So if you go to page options and you want to view the abstract for each of these references, then you can click on detailed format here, scroll down and apply. And that will allow you to review the abstracts for each of these items where they are available, as you see here. Now, it does obviously mean that this page is a bit more cluttered. You got more text on screen, so obviously you may want to revert back to the original standard format if necessary. But what you can do here at this stage, if you decide that you need the item 1 here, then click the add to folder icon. You can do it for each of these items. I've got 3 so far saved there. And if you want to select the page results, then scroll to the top, go to share, and you can see results 1 to 50. So the maximum number of results you can currently save on this interface is 50 per page. So click on that link. Okay, so they're now saved. But if you scroll to the top of the screen and go to the toolbar, click folder, then you'll see these 50 records are now stored in this folder. Now at this stage, I'm not signed in. So what will happen now is I can either process these quite quickly, I can select these or any of these, then go to print or email, and I could forward these references here to myself. I would generally say untick PDF, because if you have 50 articles which have PDF attachments or articles associated with them, they'll be sent separately. So you could end up with a lot of emails in your inbox or the inbox of the recipient. You may want to untick HTML full text as well. We're just going to get a list of references initially in this case, but we can include the current search history. So that's keeping a record of how we've been searching, how we've been refining, etc. And that will be sent as an attached file. So that'll be a nice table, a layout of your search, how you perform the search in HTML format, by the way. You can choose the standard field format, brief citation, or if you want to include the abstract, or for more detailed citation abstract, you can include that, or otherwise choose the citation format. Again, we'll go for let's go for Harvard again here, and then you click send here. So that's been confirmed as being sent. Now that's okay if you've not signed into your folder. If you don't want to set up a folder account, that's fine, but you process it. The danger, of course, is if you have not signed into your folder, or if you've not created a personal folder and the session times out, maybe you leave it for more than 2 hours, then you come back, those results would have gone. Likewise, if you close the browser by mistake, so if like me, sometimes you've got multiple tabs open, you close the wrong one, then you'll lose these results. So as a safeguard, it would be better just to sign in here. So click sign into my EBSCO. And then you'll notice here, because I'm authenticated with Open Athens through the NHS England site, as it were, through NICE, I am now, a folder has been created for me already, okay? If you are not in NHS England, you will need to create one. I'll point you to the tutorial for that and how to do that, okay? So these results would therefore now be saved beyond the session. So if I close my browser by mistake, or if the session times out, I can sign back in through Open Athens, come to this CINAHL, go to the folder, and those results will be stored here. Okay. Now, one thing you'll notice here, I've saved these references with the abstracts. There's a lot of text on the page here, but if I go back to my result list, and change the page options on screen to standard again, scroll down, click apply, then what you'll see, this is changed on this page, but also if I go back to my folder, it's also changed here as well. So I can now focus on the references rather than just the abstract. Okay. Notice also you still got the same links. You can still access the full bibliographic record by clicking on the article title. You have the PDF links here. There is another one here for this configuration, by the way, is for the NHS England in England. So you may not see the same kind of branding that you see here for yourselves within the university sector or in other parts of the UK, England, Scotland or Wales, Northern Ireland, or in Ireland. If you work in the HSC, you may see different links here shown. But the access item here relates to the link resolver, which is the EBSCO link resolver, which is full text finder. So you have the libkey link resolver provided by Third Iron. So they're another company, but providing access to additional full text content. Likewise, EBSCO has its own equivalent of that, full text finder, which is nationally available in the NHS in England, that also works to provide additional access to full text content, which may not be provided directly by EBSCO. Okay, so this takes you to a ProQuest article, or article from the ProQuest resources, as it were. Okay, so it's just another means of getting to full text, really. So again, the main thing for yourselves, if you're an end user, is getting direct to the full text. If you work for the library service, it's just understanding what these links are doing. But these have been agreed and set up at a national level. So there shouldn't be anything you need to change there. If you work in the library service in England, in the NHS, then you will have maybe some additional subscriptions, but we won't get into that today. But again, just to explain the different links that are available, access item is using the full text finder link resolver, get PDF is using Third Iron's libkey Nomad link resolver. And the bottom line is they're providing access to full text content, okay, as an alternative to going straight to the HTML PDF links that we saw just now. Now, in the result, in the folder list, you can also process these. So, for example, I can save these individual records again, and I can print them from here. I can include the current search history to be printed as well. I can also go back here, email as necessary as well. So once I've run my search, once I've saved my items, I can send an email with these items. And again, I can take HTML full text, PDF as separate attachment. I can include the current search history as well and choose the citation format here and send. Okay, now, of course, if you're working your way through the result list, as I've been doing, you would probably want to go back and, go to other items and save them also and add them to the folder as well. Okay. So again, any questions or comments, any feedback at this time, especially for those who are perhaps new to CINAHL, or even if you've used it for a number of years, any comments will be welcome on the Teams chat. I will also mention at this time, we have the publications link there on the top toolbar again. So if you're looking for a journal, for example, the British Journal of Occupational Therapy, just type for it and run a search, and you see it's appearing anyway. Okay, and you see we've got a link here. So we have the indexing of this journal from 1986 to the present. So click through to the title. Okay, so you can see we've got the publication page here, and we've also got the issues that you can explore. So if you want to look at the latest issue of this journal, click through to that link there. Now, this journal is available full text within CINAHL Ultimate, but you'll see here with the Third Iron libkey link resolver, you can get some of the articles here. Another option that you'll see for those who work in England for this particular setup, there is this item to request, this button to request this item. Okay, so if you click that link here, opens up an interlibrary loan form. Okay, so this will, you can request the articles. It's not available directly full text, but you can request it through the NHS library service, as it were. So go locally to the appropriate library team, okay, where you are. So again, you may not have that functionality if you work in the university sector, other areas outside the NHS, you may not have those features, but this is just another option to get to the full text, in which case you'll get a print copy or PDF, etc., sent externally, as it were. So again, those are available. But publications just allows you to access the journals to see what's in each issue, etc. So you can explore those issues there, okay, as needed. So let me just see where we are currently. So I think what I might do at this stage is go now to the help menu on the right-hand toolbar, click on that link. And this is the generic help for EBSCOhost. So EBSCOhost is the platform, as I mentioned. CINAHL is the database we're using on EBSCOhost. So the functionality for EBSCOhost database is largely the same. So if you want to look at how to use the limiters, there's a reference point there. There's also things like your search history. We won't go into too much detail about that today. There's other things like using the thesaurus. Oh, sorry, indexes here, I mean thesaurus here. Okay, but again, we cover some of this in the next section, which is advanced searching. Again, you might want to sign up for that. There's information on using the folder. Again, we touched on that today. Okay, and there's a tutorial associated with that. So again, you might want to watch that. It should talk about how to set up an account if you do not already have one. Okay, so it's worth referring to that. Others like printing and emailing, again, there's links there to the appropriate menu for this functionality. So again, on the left-hand column, it gives you a variety of links there to get that content. Again, more information, reference styles here. So for example, Harvard, and you can link through to other documentation for support there. Okay, and if you scroll down, go to the bottom, the link on the bottom there, CINAHL will take you to the CINAHL help screen, as it were, again, with the reference point, searchable fields, etc. Now, we do have additional items as well that you can refer to. What we've tried to do is collate information. So click New Search here, just to clear the screen. We've also got training resources portal. So this is something I came up with about 18 months ago. Basically, the idea of collating key training documentation information in one place. So this is Stack's content management solution. And you have here, for example, training videos. These are past recordings. So while you're waiting for this recording to be edited and being made available, you can explore this site. Okay, so it gives you various edited recordings of previous sessions that I've run. Okay, so you can look at those. That's the EBSCO UK YouTube channel, and they do have subtitles included as well. We have training sessions. So again, additional training. I've updated this recently. So there are now sessions that you can join and sign up for. Not sure what happened there. There's this one on Medline, for example, and you can go through and book that session from this page, etc. For information, this includes the link to EBSCO Connect, which is our main support portal. So you can go to the tutorials here and explore more information here. So again, if you're looking at the searching on CINAHL, we do have specific sessions on CINAHL here, basic searching using CINAHL headings, etc., continuing education modules. But I'd also advise going to the EBSCO Research Database tutorials because this covers the basic functionality. There's an introduction to EBSCOhost. So again, we're using the platform today. There's the My EBSCO folder, for example, as well. Okay, thanks, Emily. Okay, so that's just some items there. So, and for those, in fact, what I might do now is just jump back to the PowerPoint because of time. I think I'll go back to the PowerPoint now. So let me just stop here and go back to the PowerPoint. So again, the training resources portal, there's a link there to it. And what I might do also, I'll put the link in the Teams chat as well for you to refer to. So let me just do that now. So you can click on that and check that in your own time as well. Okay, we also have the links there. And there's additional information for those who are working in this training. There's also EBSCO Connect again, and there's promotional materials available as well. So EBSCO Connect is the main support portal. Again, there are tutorials there. For those who are library staff in this meeting, there's the learning link that takes you to EBSCO Academy. So these are sessions intended for library staff only. So you'll see the e-learning paths. This will take you through to the e-learning path for CINAHL, for example, which takes you through the whole range of topics related to CINAHL. So what it is, searching, browsing, saving results, and so on. So again, that's something you could take in your own time. It is free, but it does require that you sign in to EBSCO Connect to access it, to register for those courses. Again, you can go to my Calendly page directly to view the latest sessions and sign up for them. If you are a librarian or a member of the library team and want to arrange a core consultation with me about a specific matter related to training, then you can do so, and you can also schedule a customized online training. This is not for students, by the way, at whatever level. Okay, so I think we'll stop there. Thank you.